Hey everyone, welcome back. I'm really excited to hear what you all think about today's topic. Make sure to leave your thoughts in the comments because I'd love to know your opinions. Do you ever feel like your brain is in a fog and you can't think clearly? Do you struggle to focus on your tasks and get easily distracted? Do you feel overwhelmed by stress and anxiety? If you answered yes to any of these questions, then you are not alone. Brain fog is something that many of us struggle with from time to time. You know that feeling of being mentally cloudy, forgetful, and unable to focus? It can be really frustrating and can interfere with your daily activities, whether it's work, school, or personal life. But what causes brain fog, and how can you get rid of it? In this video, we're going to share with you some of the possible causes of brain fog and some effective strategies to treat it. So, let's start with the possible causes of brain fog. Brain fog is not a medical condition on its own, but rather a symptom of other factors or underlying issues. Some of the common causes of brain fog are: number one, hormonal imbalances. Hormonal imbalances can significantly contribute to brain fog by affecting the brain's neurotransmitter activity and overall cognitive function. Hormones like estrogen, progesterone, and thyroid hormones play crucial roles in regulating mood, energy levels, and mental clarity. When these hormone levels fluctuate or become imbalanced, they can lead to symptoms such as memory issues, difficulty concentrating, and a general feeling of mental sluggishness. These can also affect the brain's neurotransmitters and blood flow, trouble focusing or multitasking and feeling foggy or sluggish. Number two, nutritional deficiencies. Your brain needs certain nutrients to function properly. One of the most important nutrients for your brain is vitamin B12, which is essential for the production of red blood cells, protect your nerve cells, and producing neurotransmitters, which are chemical messengers that regulate your mood, memory, and cognition. Vitamin B12 or B6 deficiency can cause symptoms like fatigue, depression, memory loss, and brain fog. Other nutrients that are essential for your brain are omega-3 fatty acid and magnesium. Omega-3 fatty acids are essential fats that your body cannot make on its own. They play a vital role in your brain structure and function. Omega-3 fatty acid deficiency can cause symptoms like dry skin, hair loss, joint pain, and brain fog. Now we have magnesium, which is a mineral that is involved in over 300 enzymatic reactions in your body, including those related to your brain function and energy production. A magnesium deficiency can cause symptoms like our muscle cramps, headaches, insomnia, anxiety, and brain fog. Number three, anemia. Anemia can trigger brain fog because when the body lacks enough red blood cells or hemoglobin, it struggles to deliver adequate oxygen to the brain. Hemoglobin is a protein that carries oxygen from your lungs to all parts of your body, including your brain. Anemia also causes an imbalance in brain chemicals such as serotonin and dopamine, which play crucial roles in mood regulation and cognitive function. When these neurotransmitters are out of balance due to inadequate oxygen supply, it can lead to mood swings, irritability, and a feeling of mental dullness, all of which contribute to the sensation of brain fog. Anemia can be caused by various factors such as iron deficiency, vitamin deficiency, or blood loss. Number 4, lack of sleep. Lack of sleep can significantly impair brain function, leading to brain fog, as it deprives your brain of the rest it needs to function optimally. When you don't have enough sleep, your brain has less time to process and store information, which can lead to memory lapses, poor attention, and reduced mental clarity. Lack of sleep can also affect your mood and emotional regulation. Number 5, medications. Medications can also cause brain fog as a side effect or interaction. Some medications that can affect your cognitive function include antidepressants, antihistamines, painkillers, and sleeping pills. These medications can interfere with the activity of neurotransmitters or blood flow in your brain, which can impair your memory and brain function. If you notice brain fog while taking these medications, talk to your doctor about adjusting your dosage or switching to another drug that may suit you better. Number 6, fibromyalgia. Fibromyalgia is a disorder that affects your muscles and soft tissues. It causes chronic pain, tenderness, fatigue, and sleep problems. It can also affect your cognitive function and cause a type of brain fog called fibrofog. Fibrofog can make it hard for you to focus, remember things, or perform mental tasks. The exact cause of fibromyalgia is unknown, but it may be related to abnormal levels of certain chemicals in your brain or nervous system. Number 7, Alzheimer's disease. Alzheimer's disease is a type of dementia that affects your memory, thinking, and behavior. It is caused by the buildup of abnormal protein deposits called amyloid plaque and tangles in your brain cells. These plaque and tangles interfere with the communication between neurons and cause them to die. As the disease progresses, it causes more severe cognitive impairment and brain fog. As you can see, there are many possible causes of brain fog, and sometimes it can be hard to pinpoint the exact one. That's why it's important to see your doctor if you experience persistent or severe brain fog that interfere with your daily life. Now, here are some general tips that will improve your brain function. Number 1, find healthy ways to cope with stress, such as meditation, yoga, exercise, hobbies, or talking to someone you trust. Number 2, exercise regularly. Physical activity can boost your blood flow, oxygen levels, mood, and energy, so aim for at least 150 minutes of moderate exercise per week. Number 3, stimulate your brain. Keep your mind active and engaged by learning new things. Reading books, play games, solving puzzles, or doing other cognitive tasks. Number 4, improve your sleep. Aim for 7 to 8 hours of sleep per night to keep your brain healthy and alert. To improve your sleep quality and quantity, you can follow some good sleep hygiene practices, like avoiding caffeine, alcohol, and screens before bed, sticking to a regular sleep schedule, and creating a comfortable and dark sleeping environment. Thank you for watching. If you feel this video could help others too, give it a like and share it. Your action could be just what someone else needs.